Welcome to 10 Kids, 2 Docs. I'm Dr. Sylvia Bank, and I'm joined by my good friend and co-host, Dr. Vivian Carlin. Between our two households, we're navigating life with 10 children, so we know how chaotic parenting can be. As Johns Hopkins-trained pediatricians, we also know the science. Our goal is to bring you the best of both worlds, medically sound, trustworthy advice, and practical, real-world insights as we dive into the trials and triumphs of parenting. Please note this podcast is not intended to be a substitute for medical advice, diagnosis, or treatment from your doctor.
Hi, and welcome back. We are joined again today by Dr. Scott Krugman. He is a fellow Johns Hopkins-trained pediatrician and the dean of a regional medical school campus with the George Washington University School of Medicine. Welcome back to our show.
Thanks for having me back.
So in today's episode, we are going to be highlighting the disease hepatitis A. The reason why we're addressing this disease in specific is because in December 2025 and January 2026, the Advisory Committee on Immunization Practices, or the ACIP committee, changed the recommendations of certain vaccines that had classically been on the routine CDC recommended childhood immunization schedule.
So I think there's a couple things to highlight. One is the fact that the American Academy of Pediatrics, who has been coming out with vaccine recommendations since the beginning of time, didn't change their recommendations at all. And the reason they didn't is because they've been reviewing the science and the literature and the evidence for years and years and years, and nothing has changed. So there was no difference between December 2025 and December 2024. The only difference was who was on the committee making the recommendations. And as it turns out, the group that was on the committee was kind of appointed illegally, and the judge has now said that they should have been appointed because they are actually experts. So we have a group of anti-vax experts who are making recommendations around vaccines and just making it murky for everybody. And I think that's the most important thing, is that instead of following traditional, this is the data, this is the new data, this is how we're going to make a decision, they said, this is how we feel, this is our gut instinct, and we want to change it. And what they changed to is something that is really what we're doing in practice already. Like, I don't think I've had a non-conversation with shared decision-making about vaccines in 20 years, because every time we talk about vaccines, I'm talking about what they're for, and the parents are talking about what their questions are, and it's shared decision-making. There's no vaccines that are given without the parents understanding the risks, the benefits, the side effects, and why we're doing it. So it just created a category that has become murky and strange and has further diminished the general sense that vaccines are good and safe. And it's just slowly eating away at our vaccine rates. And as a result, we're now having massive measles outbreaks. And we're going to soon have even worse pertussis outbreaks. And get ready for who knows what next, but it could be polio, right?
I think that's such a good point, because one of the things that frustrated me the most when this new recommendation came out was this idea that this was something new, because this is what we've always been doing. I always talk to patients about hepatitis A and rotavirus and meningococcal disease. This is not some new thing that we are now going to have a discussion together. That's always been the case.
And we were hoping maybe now that these vaccines have been quote unquote highlighted or placed in a special status, that maybe we should do a little bit more in describing these particular diseases to kind of start that joint decision-making process in the podcast, where listeners can begin to hear our thoughts on the following diseases, right? So we were hoping maybe to start with hepatitis B, right? In specific, just because it's now on the shared decision-making category. And I was hoping that you could first kind of give your general thoughts about the disease and the vaccine.
Yeah, so infectious hepatitis has been around for a long, long time. And back in the 40s and 50s, especially in congregate settings, there would be intermittent outbreaks of two different forms of hepatitis. One was hepatitis A, which is actually transmitted quicker and easier through the fecal-oral route, which we'll get to in a second. The other was hepatitis B. But the researchers, nobody really knew which one was which, because back in the 50s, they just knew by the clinical course. Some people got it bad, some people got it mild and got better. So it took a lot of work to sort of separate those two out. And what was learned eventually was that hepatitis B was the more severe version of that. There are some people who get it and it never goes away, and it can lead to cirrhosis of the liver, which is chronic liver failure. It can lead to hepatocarcinoma, which is liver cancer. And those people end up with really, really bad outcomes and end up on transplant lists. Or it can present as cases that I've seen where the teenager comes in with their first case of hepatitis B and they go into fulminant liver failure immediately and are placed on the transplant list within days. And you go from a healthy kid to the transplant list, and that's a pretty big shock, right? So this is a disease that if you have, you might not know you have. You can pass it on in a variety of different ways. It's not just IV drug users. It's not just sexual activity, but there are other ways of passing it along. It can go through bites. It can go through infected secretions and things like that. I will add the most important from the pediatric standpoint is perinatally acquired. So if moms don't know they have it, they can pass it on to their baby, and those kids turn out to be the ones at highest risk for chronic hepatitis and having the long-term problems. So the strategy since a very effective vaccine came out in the 70s, 80s, and especially the 90s was let's start with screening moms and doing testing for moms. And that worked pretty well, and the rates came down a little bit, and like, well, let's look at the evidence. It turns out that if you did hepatitis B for every single baby when they were born, you could substantially reduce that risk, and it allows you to not have kids slip through the cracks. So
You mean hepatitis B vaccine at birth?
yes, we live in the United States, and we have a lot of people who don't get prenatal care. We have a lot of people who don't follow up. We have a lot of times where you might be negative at one point and positive at another. And when you have a vaccine that is a small component of a protein into a vaccine that it's not live, it's not shedding, it's not inducing a huge response, but it protects you for a lifetime, that if you give a baby in 3 doses, like, why wouldn't you, right? And as a result of that, in the 2000s, the rates of hepatitis B universally, not just in kids, but has dropped immensely. And we could actually end up a few generations from now of just not having hepatitis B if everyone got vaccinated as babies, and it goes away, right? It doesn't have to keep going. And it's astounding. Like, the risk-benefit ratio is off the charts, right?
I think it might be helpful if we just quickly review what puts you at higher risk for hepatitis B.
Yeah, just a few of the risk factors are, a history of multiple sex partners, IV drug use, congregate living in institutions and things like that.
Okay, so, our listeners know we did foster care for years. I have 2 children adopted from the foster system. I know a lot of families with children that were adopted from the foster system, and it does scare me to think, because foster children are so much at risk of not having had any prenatal care and potentially having been exposed to maternal IV drug use. It does make me afraid to think if those children had not been in the era of universal hepatitis B vaccination at birth, how many of them would have become hepatitis B positive. So I personally feel very grateful that my children were born during that era, that it wasn't even a question, right? On the flip side, to play devil's advocate, a parent is going to come back and say, if I know that I personally as mom have no risk factors for hepatitis B and I've tested negative and I have all of my prenatal care, can I defer this for my newborn? Why would it be recommended for me to give it to my newborn at birth?
And that is a fair question. And again, am I fighting tooth and nail to get parents to do that when they're like, no, it's fine if I do it at the 2, 4, and 6 month visit? No, I'm not. But they have to understand that you could have seroconverted. There is a chance you're putting your child at risk.
I would love to hear a little bit about was it your grandfather who was involved in the development of the vaccine?
So many people have heard about the Willowbrook studies on hepatitis, but back in the 50s, the Willowbrook Institute was literally where they put all the kids with developmental delay, autism. It was not a great place, right? It was too many kids in unsanitary conditions, and they would have massive outbreaks of hepatitis. And again, this was at the time when it wasn't real clear between hepatitis A and B.
I actually read a book about Willowbrook as part of my book club. And the book was entitled The Lost Girls of Willowbrook. And it's a story that blends real history with a fictional story. And I had never heard about Willowbrook before I did this book club and read this book. But Willowbrook is a state school that was actually located in Staten Island, New York. So in New York City, but not in Manhattan. It was a state-run facility for children, and it was known to house children with intellectual and developmental disabilities. It was operated for over 40 years, from the 1940s until the late 1980s. And by the 1960s and 70s, it started getting more press, and there were some pretty horrific living situations for these children in the Willowbrook State School. There was overcrowding, where there were thousands of kids beyond the capacity of the school. There were sanitation problems there, and children were often left in filth and neglect. And there was also widespread abuse and lack of medical care. Children were often left unattended, unclothed, or restrained. It was basically a center for child abuse. Parents admitted their children with special needs there, and then they were basically neglected and abused in this state school. And interestingly enough, in 1972, Geraldo Rivera, who I think you and I know from our generation as this like inflammatory talk show host, he was actually a journalist in the 1970s, and his big claim to fame and what brought him nationwide notoriety was that he released a televised investigation that actually showed the conditions inside of the Willowbrook school, and that footage kind of exposed Willowbrook for what it really was and shocked the nation from these conditions and sparked public outrage against the school.
I just have to interject 2 comments, Sylvia. I mean, first of all, nerd, like who in the world chooses that for leisure reading for book club? I mean, right? That does not sound fun. And secondly, I didn't know Geraldo Rivera was such a champion for human rights and ethics. So good for him for exposing such abuse.
So this is kind of like the setting in which back in the 1950s and 60s, historically, it was known that some controversial studies were done on these children where they were intentionally exposed to hepatitis to study the disease. And now, obviously, that type of experimentation is now considered unethical.
It was not a great place, right? It was too many kids in unsanitary conditions, and they would have massive outbreaks of hepatitis. And again, this was at the time when it wasn't real clear between hepatitis A and B. And so my grandfather was working at NYU and was brought in and asked to help try to contain this outbreak. So he and the research team figured out that there were 2 different versions. There was the GI version and there was the hepatitis B version. And they isolated the hepatitis A virus and then isolated the antibody for the hepatitis B. The antigen was found by Bloomberg in Australia. So when they put the 2 together, the antibody and the antigen, they then figured out hepatitis B is. It's a DNA virus that creates this antigen in the cells. And from that point, they were able to kill the virus, and he then created the first hepatitis B vaccine that then became the hepatitis B vaccine that Maurice Hilleman developed. That's what led him down the vaccine path.
So this is your paternal grandfather.
Correct.
Wow, that's fascinating. I want to make one other comment on what you said, and I often, this is another kind of mantra in my parenting, is I often say to people, if your children are all rule followers and they don't scare you at all with any risk-taking behavior, you probably just don't have enough children. So I think between Sylvia and I and our 10, I can attest to you, I parent with a lot of prayer in mind, but I am constantly mitigating all possible things that could happen. And I like to check off the list. I've protected you against hepatitis B in the unfortunate event that you make poor choices in the future.
Yeah. No, again, if there were a vaccine for HIV, you better believe I'd be giving it to my kid, right?
Absolutely.
I mean,
absolutely.
Why would you want even that potential risk, right? All these things it's a lot easier to get the vaccine than a liver transplant. Let's just put it that way.
Yeah. In the second half, I'd like to turn our attention to hepatitis A. That's the one that spreads through the fecal-oral route. We mentioned that before. And what that means is that's transmission where the virus, in this case, is in feces, it's in stool of an infected person or even an animal. And then that feces contaminates something else. Like in the case of food outbreaks, like a lot of farms will use animal manure as fertilizer. If that fertilizer happened to contain traces of hepatitis A, that could be on the food. If the food isn't properly washed, that could continue to live on the food, and then there could be transmission to the individual or individuals that eat that. So let me give you another example. A baby that has diarrhea, the person changing the diaper, if they're not really practicing great hand hygiene, there's a possibility for that virus to live on the hands. And then when the person touches surfaces, for it to be transmitted to surfaces and it be picked up from other people that way. So it could be a person not washing their hands properly. It could be touching contaminated surface like toys or changing tables in daycare centers and then touching the mouth. Or it could be eating raw fruits and vegetables that happen to be exposed to hepatitis A, and that's why we see outbreaks in food. So let's turn our attention now to hepatitis A.
So let's hear a little bit about hepatitis A in specific.
Yeah, can you describe hepatitis A?
Like, if you have 100 people with hepatitis A, the vast majority won't have any symptoms. Some will have a low-grade, mild febrile illness type thing, but the ones that have a more severe will have some liver inflammation where their liver enzymes, the markers we look at, go up. They can turn a little yellow or jaundiced. You feel just nauseated and gross for a couple weeks, and then it slowly gets better. But it's not a fast thing. It won't progress to chronic liver disease, and it won't progress to the need of like complete liver failure or needing a transplant. But you're not going to feel great, and your doctor's going to be worried about you. You're going to be getting blood work all the time until your liver enzymes go down.
I have often seen in the news little outbreaks of hepatitis A in different produce. So it will be like green onions from Ohio, or it'll be green peppers that originated from this port in Pennsylvania. So hepatitis A is still seen in outbreaks throughout the United States from contaminated produce and can cause this acute form of liver inflammation. Sometimes they originate from farms, and then they'll be sold in our retail stores like Trader Joe's or Costco or Aldi, and all of the produce from that one stock is at risk for causing a hepatitis A in any of the consumers that buy it, right?
Right. I mean, it can be from all kinds of things. I'm looking that there was one outbreak in 2022 that was due to organic strawberries. There was an outbreak in 2012. I think this is interesting. That was due to pomegranate arils imported from Turkey. I mean, so specific. Anyway, Great surveillance how we find these things out and like link them back to a cause. But all to say that these pockets of outbreaks do still occur, and they're very hard to. There's no way to predict.
Mm-hmm. And the one way of preventing getting hepatitis A from these outbreaks every now and then is to be immunized against the hepatitis A virus with the hepatitis A vaccine. The hepatitis A series is a 2-shot series that is given, and after that series is given, then the child goes on to have lifelong immunity against hepatitis A.
But again, this was another vaccine which used a similar technology to the hepatitis B. I actually was in the hepatitis A vaccine trial back in the early 90s when I was doing research at NYU over the summer in college. So I got snuck in, had a connection there. The vaccine trial was very clear. It was safe, it was effective, it didn't cause very many side effects. And what we've seen since doing it universally is that all those big outbreaks are not happening as much, right? And we're not having as many people sick with it. And it really is a community-wide thing, right? The more people are protected against it, the less likely it is to occur.
I am just reminded again that we live in this place in the world where we have had the benefit of these high vaccination rates, and we can even be having this discussion about whether or not to do it. If I take these vaccines and think about traveling to another country, I would be terrified not to have these vaccines, especially when you consider access to medical care. But hepatitis A, even hepatitis B, I just can't even imagine wanting to take that level of risk, which is all about how widely are they circulating in other places versus here. And if we shift and we get to the point where they're circulating here, we should have that same fear that we would in another country.
Yeah, it gets back to two key points. One is most people, and obviously even doctors, aren't familiar with these diseases because they just aren't there because the vaccines have been working so well to get rid of them, right? At least in our country. And two is all of these diseases are a plane trip away. There is a lot of hepatitis A in any underdeveloped country out there. And there's a reason why even the current CDC still has their travel guidance for every single country and what diseases they have and what's at risk. Like, there are specific things for travel that are really important. And you really don't want to get sick in a third world country or bring back an illness to the rest of us. We don't really want your disease. So it's a little bit of responsibility, and we don't want parents to have to deal with these illnesses. And going back to the very beginning, there's a reason why there's vaccines against these illnesses, because they really aren't that fun.
Our hope is now that we have empowered parents, empowered you, the listener, as parents, to understand hepatitis A and hepatitis B well enough to go into this joint decision-making discussion with your pediatrician with some base of knowledge so that you now can have an informed discussion to decide what's best for your child.
So I want to thank you, Dr. Krugman, for coming on our show today and sharing your pediatric knowledge and medical knowledge with our listeners. It's really great to have you back.
Thanks for having me. It's a very fun time, and it's great to be able to get information right to parents.
So this is 10 Kids, 2 Docs. I'm Dr. Sylvia Bank.
I'm Dr. Vivian Carlin.
And I'm Dr. Scott Krugman.
We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.